Hi, my name is Dr. Kelly Stacy. I'm an internal medicine doctor and I work here in Rapid City, South Dakota. I work at Monument Healthcare System, and with that I work both with patients in the hospital and in clinic. As a doctor, what I'm typically doing is trying to help patients. Patients come in when they're sick. We try to figure out what's wrong with them. We try to help them get better and how to fix it. We try to figure out if it's medicines or therapy or what type of treatment it needs to make them to help get better. We also take care of patients who are well. Just like when you guys go to the doctor, you go get your shots, adults still have to do the same thing. They have to go in regularly to make sure that they're doing okay. We have to do health maintenance. We have to make sure they have their shots. And we just have to make sure they're doing okay to help keep them healthy for the future. As an internal medicine doctor, I typically take care of adults. That means anybody 18 and over we help take care of. There are other types of doctors that do similar types of medicine. We have family practice doctors that do anybody from when they're born to when they are old. And then we also have pediatricians. So you guys have already seen either a pediatrician or a family practice doctor. But by the time you turn 18, people often change over to an internal medicine doctor. So when you're becoming a doctor, typically you go to medical school. So that's after college. You go to medical school for 4 years. Then what happens is you choose a residency program. That's when you specialize. So for me, I became an internal medicine doctor. There's also family practice doctors and pediatricians. And so typically we're the type of doctors that do primary care. We also have surgeons, and there's lots of surgeons. There's general surgeons, there's people who are orthopedic surgeons who help you if you break a bone. There's neurosurgeons that help if you need brain surgery or spine surgery. So there's lots of those type of doctors also. There's also doctors that help in the laboratory, such as pathologists. We have cancer doctors, and the list is endless. Any type of patient that needs help, there's a type of doctor for them. Growing up, I always loved sciences and math. I remember I used to go hang out with our veterinarian and actually watch them do surgeries when I was in elementary, so you could be doing things like that. I have 2 kids who actually both really love science also, so one day they may be doctors also, but even if they're not, they're going to be nurses or they'll be different types of healthcare workers to help patients. But when you like sciences, very commonly you like science in general, you like anatomy and physiology, or you like biology, and these are learning how to take care of or how to learn about the body. But then also people do a lot with math, and really having an expertise in both of these is great to become a scientist. You love to learn, and that's what science and being a doctor is all about, is learning as much as you can to help your patients and just having that love of learning. I absolutely love being a doctor. The beauty of it is people come to you when they need help. They always come when they have problems and they feel that like they can trust you. They come asking for your advice, and you get to help figure out how to help them. And so it's a really nice relationship with patients. You really get to know each other well. You help them when they need you the most, but they also come in when they're well. And that's nice too, because then you get to see them at their best. So typically a day means that I start off my day either in the hospital or at inpatient rehab. I will see patients there, and that's when people are really sick. They're in the places where they need specialized care. So then after that, I'll go to my clinic where I see people on a regular basis throughout the day. Those patients become my patients, just like when you see your pediatrician, you know them and you see the same doctor year to year. So with that, we get to see each other, we get to help each other through learning and how we are doing. We get to make sure they're doing their shots. And so throughout the day, I'll be seeing patients, usually anywhere from 10 to 15 a day. And they come in, sometimes they're sick and sometimes they're healthy, and we just figure out what they need. So what's really nice for patients is if you can talk to a patient. So I know you guys all love to be on your phones and you love to text, but actually talking to a patient's really important. Having them feel comfortable where they can talk to you and open up what they're scared about or what's making them not feel so well is really important. So looking somebody in the eye, talking to them face to face, and really listening to them is a very important skill of being a good doctor.